Welcome to Explain, a series of health education programs published by the Patient Education Institute, the leading provider of interactive health education. This video includes general medical information and does not replace the medical advice of your doctor or healthcare provider. If you have questions pertaining to your medical condition, ask your doctor or healthcare provider.
Cochlear Implants. Introduction. A cochlear implant is a small electronic device that can help a person sense sounds. They are used by people who are deaf or severely hard of hearing. A cochlear implant can help a person understand speech. It does not restore normal hearing. Both children and adults can benefit from a cochlear implant. This program explains cochlear implants. It covers reasons for cochlear implants and alternative treatments. It also talks about what to expect before, during, and after the procedure. The ear. The ears are specialized organs that allow us to hear and to keep our balance. Each ear has 3 sections. 1. The outer ear, which includes the auricle and the ear canal. The ear canal leads inside the ear to the eardrum or tympanic membrane. 2. The middle ear, which is formed of 3 small bones known as the ossicles. 3. The inner ear. Cartilage covered with skin forms the auricle. Unlike bone, ear cartilage may continue to grow throughout life, which is why older people usually have bigger ears than younger people. The auricle acts like a satellite dish to collect sound waves, which are vibrations in the air. Sound waves cause the eardrum to vibrate. These vibrations cause the 3 small bones of the middle ear to vibrate in turn, transmitting the information to the inner ear. The vibrations sent to the inner ear are then relayed to an organ inside the inner ear. It is known as the cochlea. The cochlea has a snail-like shape. Inside the cochlea, the vibration is changed into electrical signals. A nerve called the 8th nerve, also known as the auditory nerve, carries the electrical signals to the brain. The brain understands the electric signals as sounds. Another part of the inner ear is responsible for balance. The 8th nerve also carries information to the part of the brain that is responsible for balance. Hearing problems and balance problems often happen at the same time. Having 2 ears helps us figure out where a sound is coming from. Sound waves reach the ear closest to them before reaching the other ear. Even though the difference is less than 1 second, it is enough for the brain to identify where the sound came from. What is a cochlear implant? A cochlear implant is a small, complex electronic device. It bypasses damaged part of the inner ear and directly stimulates the auditory nerve. Hearing through a cochlear implant is different from normal hearing, but it allows many people to recognize warning signals and other sounds in the environment. It also allows people to enjoy a conversation. The cochlear implant consists of an external portion that sits behind the ear, a second portion that is surgically placed under the skin. A cochlear implant has the following parts: a microphone, a speech processor, a transmitter and receiver stimulator, an electrode array, which is a group of electrodes. A microphone picks up sounds from the environment. The sounds are selected and arranged by a speech processor. Signals from the speech processor are sent to a transmitter and receiver stimulator. These parts convert the signals into electric impulses. The electric impulses from the stimulator are collected by the electrode array. The electrode array sends the impulses to different regions of the auditory nerve. Adults who have lost all or most of their hearing later in life often can benefit from cochlear implants. They learn to associate the signal provided by an implant with sounds they remember. Cochlear implants, coupled with therapy, can help young children improve speech, language, and social skills. Most children who receive implants are between 2 and 6 years old.
Sponsored by the Patient Education Institute. www.patient-education.com. Over 5,000 videos and interactive tutorials.
Alternative treatments. Cochlear implants may help people who are profoundly deaf or severely hard of hearing. Treatment of hearing loss depends on its cause. Hearing loss may be caused by a perforated tympanic membrane and stiff ossicles. These problems may be repaired through surgery. Clogged ear canals also can cause hearing loss. The canals may be opened up and cleaned. This is done using a small special probe and an otoscope or a microscope. People with hearing loss can benefit from devices such as hearing aids and assistive devices. Captioning, sign language training, education, and social support can also help with communication. Hearing aids may also be needed to make sounds louder and cut down on background noises. Some hearing aids fit inside the external auditory canal. They cannot be seen. When external hearing aids do not work, implantable hearing aids and cochlear implants may be helpful. Before the procedure. Before the procedure, you will undergo testing to determine if you are a good candidate for a cochlear implant. The benefits from a cochlear implant depend on many factors, such as the age of the patient, whether the hearing loss started before or after the patient developed language skills. Testing often includes a medical examination, hearing tests to determine the level of hearing loss, psychological testing or counseling. The medical exam looks at the external, middle, and inner ear for signs of infection or abnormality. It can involve imaging tests such as X-rays, an MRI, or a CT scan. Regular care is necessary after receiving a cochlear implant. Counseling makes sure that the patient is a good candidate for the surgery and will follow through with therapy. It is also important that the patient understand what the implant will and will not do. It takes time to learn how to use the implant. Cochlear implant. Surgery to place a cochlear implant is done under general anesthesia. This means you will be asleep and will not remember the procedure. In total, the procedure takes about 2 hours. Your vital signs, heart rate, and breathing will be monitored during the entire surgery.
First, the site of the implant must be cleaned. A small amount of hair around the ear where the implant will be placed must be clipped off.
An incision is made near the ear. The bone behind the ear at the base of the skull is called the mastoid bone. The surgeon creates a place in this bone to hold the implant's receiver stimulator. The surgeon then drills into the mastoid bone to reach the inner ear. The electrode array is placed into the cochlea. The receiver stimulator is secured to the skull. When finished, the surgeon closes the incision with stitches. Risks and complications. The risks of a cochlear implant may include those related to anesthesia and those related to surgery in general. Anesthesia is safe, but like any medicine, it can have risks. Complications of anesthesia may include reactions to the medicines, breathing problems. Rarely, anesthesia may cause serious complications such as lung infections, stroke, heart attack, death. Your anesthesiologist will talk to you before your surgery. He or she will ask about any medicines you are currently taking and will explain the risks and complications of anesthesia in more detail. Surgery in general also comes with risks. Complications may include bleeding that happens during or after surgery, infection. Risks and complications also may be related to the specific type of surgery. Rare but possible cochlear implant complications may include attacks of dizziness or vertigo, blood or fluid collection at the surgical site, numbness around the ear, paralysis on one side of the face, ringing in the ears. Rarely, fluid may also leak from the inner ear or from around the brain. The fluid may leak through the incision site. The nerve that gives taste sensation to the tongue also goes through the middle ear. It might be injured during the surgery, but this is rare. This could affect your sense of taste. It is also possible that the body may reject the implant, but this is rare. After the procedure. Immediately after waking up from the procedure, you may feel pressure or discomfort over your implanted ear. You may also feel dizzy. This is normal. You will have bandages over the incision site. The bandages will stay on for a while. Depending on how well the surgery goes, you may stay in the hospital overnight or you may go home the same day. Your healthcare provider will let you know when you are able to go home. Your healthcare provider will give you instructions on how to care for your implant site. This includes when you can start showering and how to wash your head. You will not be able to hear right away. After the surgical site has healed completely in about 3 to 6 weeks, you will have an appointment to have the implant turned on. Therapy can begin once the implant is turned on. Therapy trains you how to use the implant.
If you like this video, please like and share. For similar videos, subscribe to our channel.
Summary. A cochlear implant is a small electronic device that can help a person sense sounds. It does not restore normal hearing. Cochlear implants are used by people who are deaf or severely hard of hearing. Both children and adults can benefit from them. The cochlear implant consists of an external portion that sits behind the ear and a second portion that is surgically placed under the skin. A cochlear implant has the following parts: a microphone, a speech processor, a transmitter and receiver stimulator, an electrode array, which is a group of electrodes. Like any surgery, a cochlear implant has some risks and possible complications. Talk to your healthcare provider about the risks and benefits of a cochlear implant before having the surgery. After surgery, the surgical site takes about 3 to 6 weeks to heal. In the meantime, you will not be able to hear. Once the surgical site is healed, you will have an appointment to have the implant turned on and therapy can begin.
Thank you for using Explain.